Aronya is the guy who signaled. Nani who has taken over. You have to resign. I'm on retire. When you are ready, tell me so that we start. I'll give off the cameras.
Wait.
Are doctors, qualified doctors, practicing in the Republic of Kenya. All of them are Congolese doctors. The DRC Congo. The first time the Congolese doctors came to this country is around 2005. The Congolese doctors have been working in this country, some in private sector, where they are running mission hospitals, private individual hospitals, public hospitals, and county government hospitals. Many of these Congolese doctors, some went to school in this country from the first degree. Some came with degrees from all over the world. Some of them are undergoing a master's degree in very many universities in this country. These Congolese doctors are in this country pursuant to them being members of the East African community. DRC Congo joined the East African community, and heads of states of those countries accepted Congo as a member, that is DRC Congo, as a member of the East African community. The rights bestowed to members of East African community also accrues to these doctors. They have been working. Their papers of qualification have been verified by the relevant board that scrutinizes eligibility to be allowed to practice medicine in this country. None of the 50 members has any disciplinary issue. Under the medical practitioners' procedures, the licenses for one to practice medicine in this country, a doctor starts the process around July, August. By November, they have licenses to practice for next year. So these doctors are supposed by now to have practicing certificates to allow them practice medicine in this country. They have tried through the digital platform to access information and to apply for renewal. They have been frustrated because they are required to get a no objection letter from the minister or the cabinet secretary in charge of health. They have gone to look for that no objection letter from the cabinet secretary since July up to now. All of a sudden, the cabinet secretary appears on media and announces that Kenyan authorities will no longer recruit or offer employment to foreign doctors. He is very categorical that all doctors from the East African community will be offered employment. That information Minister Duale gave is not true. The minister lied to the public, to the country. Congolese doctors have not been allowed to renew their practicing certificates. Congolese doctors are members of the East African community. Congolese doctors have not faced that problem alone. The amount they have been required to pay for them to renew their licenses, annual licenses, increased from 20,000 to now, when the government last year took 500,000 shillings from them as annual licenses.
90 for the license, 500 for the work permit.
This is discriminatory. These are professionals. None of these people are politicians. They are in this country. They have work permits. They have husbands. They have wives. They got an oral notice that their licenses will not be renewed. The consequences of that is that as they are here, their immigration status, the status that brought them to this country, is uncertain. Are they persona non grata? Are they supposed to be deported? Because the condition of them coming to this country was that they were professional doctors from the East African community. Agreed with that, the members gave me instructions to move to the Judicial Review Division of the High Court, seeking to quash the decision of the minister, seeking for interim orders to allow them access the portal and get their annual practice certificates to go to that area. As we have these doctors here, every Kenyan knows what is going on in the health sector of the Republic. It is private hospitals and mission hospitals that have been keeping the health of our citizens intact. None of the 50 doctors can operate in a hospital. Some are surgeons. There are people Kenyans who are supposed to be operated. Their doctors cannot operate on them because they have no license. Many deaths are going to occur because of the negligence of the ministry. We are appealing to the relevant government agencies, although we have gone to court. that any government officer who is negligent and risking the life of citizens, we shall take him by his name. We have now sued the government officers in their official capacity, but we shall institute civil litigation against if any Kenyan dies, because these doctors have been denied the chance to practice. The doctors are present. They'll give you their view. They will be able to communicate in English, in Lingala, and in French, because this is an issue that affects the diplomatic question between Kenya and DRC Congo. If Kenya is chasing the Congolese, are we likely to see more than 5,000 Kenyan professionals working in DRC Congo coming back with Kenya Airways? Is it relevant to start a diplomatic tiff with the professionals who are here, who are not politicians, who are here for the purpose of saving the lives of Kenyans? Allow me to call the Deputy President of the Congolese in the diaspora to come and lay the basis for what is here before. My brother, come. You'll introduce yourself and the position.
Thank you so much, Wakili. My name is Angembe Agaton Angembe. I'm the Vice Chairman for the Congolese Diaspora in Kenya. On behalf of the Congolese living in Kenya, we want to appeal to the relevant health authorities to exempt the Congolese from this denial of performing their duties, because it's going to affect a lot of Congolese who are currently living in Kenya. We are a lot of Congolese, not only in Nairobi, there are those in Kisumu, in Mombasa, in Eldoret, all over Kenya. So when the health sector regarding our doctors is affected, it will affect most of our people. That those pregnant women, giving birth is becoming a problem. They trust our doctors. Some of the doctors, they went to school here. Personally, I've also gone to school here in international relations and diplomacy. So we are much conversant with English. And also bearing in mind that we are a member state of East African community, we really request and appeal to the government to consider the treaties of East African community, that we Congolese, they should be exempted. We appreciate the effort that has been done in East African community in regarding to other issues like immigration, that is the visa issue, that is the student visa, travel visa, all those have been adhered to. So we also request that the issue of the health is very vital to the human life. So we are on behalf of the community, we support Daktari, the Wakili here, Dr. Stan Omari, to the cause that is doing a noble cause for the Congolese doctors and also the entire Congolese people in large. Thank you so much.
Thank you. Let us have the lady address his countrymen and her countrymen in French.
Oui, je m'appelle Dr Mwangaza Kamboko. Je viens de la République démocratique du Congo. Depuis 2018, je fais mon travail en tant que médecin généraliste au niveau de ce pays kenyan. Il y a une année, ça fait plus de 6 mois, on nous a interdit de renouveler nos licences. Une chose qui est très inquiétante et qui nous affecte en tant que médecins. Et ça nous affecte même la population de Kenya. Et aussi, il y a un problème de diplomatie entre la République démocratique du Congo et celui du Kenya, parce que nous sommes reconnus comme le pays de l'East Africa, mais ça c'est la théorie, mais pratiquement nous sommes discriminés au niveau de ce pays de Kenya. Nous interpellons notre président de la République démocratique du Congo de nous venir à secours parce que nous sommes à détresse. Nous sommes à détresse au niveau de ce pays. Nous ne savons pas comment nous allons survivre dans ce pays. Je vous remercie.
Thank you. Let us address in the...
Thank you very much. I'm Dr. Georges Maloba, the president of the group of Congolese doctors in Kenya. We are here today because there is an issue that has been addressed by our Diaspora president. The problem is we are in a situation where we are being denied to renew our license for the year 2026. Of course, we have been practicing in this country for almost 10, 15 years, some of us. But today, this group of Congolese doctors are out of the system. They are being considered like outsiders, yet they are members of the East African community. The DRC joined the East African community in April 2022. And we believe that so far, there is no letter which is saying that DRC was removed or they went out of the East African community. So that's why we are coming here to appeal to our authorities in Kenya to assist us, because we have been writing letters to different offices to request the consideration of Congolese to be part of the East African community. When you go even on some websites of the institutions, you will find out that the name of DRC is not yet included in data in the list of East African community. Why that discrimination? Yet when we are about to pay the licenses, we see the price from 20,000 up to 90,000, and the work permits, of course, for 250,000 up to 500 per year. Yet the people of East African community are not paying the same amount, even if when it comes to licenses. It's less than that. But only the Congolese people who are not giving that chance to be part with other members of East African community. That's why we are calling, because the letter that we have submitted to the offices have never been answered by anyone. Even we have reminded the offices to help us to understand what is the cause, because it's very important. We are just the people. We are professionals in Kenya. We are doing our best to work according to the strict of the law of Kenya. But in this particular time, we have families here, but now we are struggling. We cannot go to the place of work because we have not renewed our licenses. That's why we are calling again to the government of Kenya, even the government of the Democratic Republic of Congo, to come together to create a zone where they can agree, they can sit together and see what is the problem, so that our people can live together. We are one family in Africa. We cannot be living divided. We need the development of our countries, but we need also to embrace each other so that we can move forward. Thank you.
I have a question. Also, have you tried to explore to resolve this standard through diplomatic means? As the DRC embassy contacted the Kenyan embassy, have you tried to resolve this impasse diplomatically?
Okay, what I will say is this. Since last year, since 2024, we started by writing letters. We started by seeing our embassy to appeal to our representative. Unfortunately, the ambassador is not around. He was repealed to the country. We addressed the issue. We gave the letter to see how they can write a letter to the Ministry of Foreign Affairs in Kenya to seek if they can accept us as members of the community. But up to now, there are several letters that we have written, either to our embassy, either to the Ministry of Foreign Affairs in Kenya. No letter have been answered up to now, since 2024, up to now. Even we started from the KMPDC to request if they can agree us to be in that law of East African doctors. But unfortunately, there is a meeting that was supposed to be organized saying that, okay, we will come to you guys to confirm if you will be on board on that list. Unfortunately, it doesn't happen like that. And then we reached the point where the verification of our documents was done. After that, we saw the portals being blocked. When you try to apply for the renewal, you see just a message appearing there, seek the letter of no objection from the Ministry of Health. We, as Congolese, we consulted despite being in different places, we collected the letters and we wrote one letter to request the CS to recognize the Congolese doctor being part of the East African community. And the letter were received to the office of the CS on 4th November last year. Up to now, no answer. So on the diplomatic level, we are still pushing and requesting all the governments, because we are just the citizen. We don't know if there's something else that we cannot know up to now. But if the government can come clearly to explain to us, so that we can be living quietly in Kenya and working to serve our communities. Thank you.
So are you saying that even the DRC government is not responding to inquiries?
Okay, so far we have not received any call. Maybe because the weekend, unless today. But if there is an emergency, we need to have at least someone who can address the issue. As the president, as far as I'm talking, have not received any call, apart the Union of Doctors in Congo. The president called me to seek if I can submit the names of the people who have been affected, so that they can see at their level what they can do for us. But it has been 3 days. Up to now, no answer.
Let us have, you can explain.
En français, je peux continuer? Je peux le dire toujours en français. Yes.
En français bien. So, I wanted just to add on what our president has just said. We are Congolese doctors living in Kenya for many years. For example, myself, my name are Leon Sulu, Congolese medical officer. I have been working in this country for more than 5 years. It's almost 9 years now. So we are in Kenya as Congolese doctors legally. Legally, I mean by the entry, we came through the main door. We got our visa from the immigration. The moment we entered, we went to the KMPDC, Kenya Medical Practitioner Council. From there is a requirement for document to be submitted, document which was supposed to be subjected to a verification, of which we did that. We were given letters which we were going to present to different employers for for a vetting to the facility, that is the facilities. You go there for a vetting. After the vetting, you get another letter from the employer saying that I want to employ this Congolese doctor because of this and this and this. And then once you go back to the KMPDC, they put all the document together, you pay the fees, you get the registration. From the registration back to the immigration with the license, there is also another requirement. You submit all the papers at the immigration levels. They will do a verification. You pay the processing fee, and then you will pay for the permit. The moment you get the permit, you are allowed to work in Kenya. That's what all of us we have done as far as the immigration and the KMPDC board is concerned. We started working for many years. It was just about to renew. I think in 2019, we received a notification from the Kenyan Medical Practitioner Dentist Council saying that all doctors should come, submit their document, because we want to do a registration. We want to register them. A fresh registration. That's what we did in 2019. We submitted a document, they did a verification, we got
our licenses.
What they call temporary registration. And then before they gave us the temporary registration, they told us we'll be having the same registration like Kenyan with the initial A. The moment we submitted, at our surprise, we were surprised because we got a temporary registration with the initial of letter C. We start working. Just last year, we received another notification from the KMPDC saying that Congolese doctors, you should come. It was a long list with many documents for a verification. Say, we want to update our system. We need to do an audit because there are many things which is happening within the country. We submitted all the documents, all the required documents, and then they told us that we were supposed to get a feedback, of which we were not able to see any feedback from that audit. Just around October, to realize that anytime we were trying to see whether the portal has been opened for us to renew our license, we saw just a red message saying that you should get a non-objection letter from the CS of L, Mr. Duale. We went to his office, first of all, to get the information, the clear information about that request for a non-objection letter. They explained to us that you should go back to your employers. They will write a demand, a request for the CS to grant you guys with a non-objection letter, which will allow you to access to the portal of KMPDC. Mm-hmm. We did that, and then we submitted all letters on 4th November because we had an umbrella letter plus individual letter. We submitted, and then we were waiting. We were doing the follow-up. We were going there. Nobody. So all we can say, they just ignore us. We could go. Nobody could care about us. Nobody was bothered to give us an answer. Even in those offices, we were just there. They just refer us to go back to our facilities. That where the letters of the non-objection will be sent. Just to be surprised, some of us have gotten the letter from the CS saying that we cannot approve for you through their facility. And then when we saw it in media, we were surprised. We tried to contact different offices, but no answer. That's when we decided ourselves that as far as the matter is concerned, let us get a lawyer and we seek a clarification, but which clarification maybe can come from the court. Thank you.
Thank you so much. My name is Dr. Leon Sibaka. I'm here in Kenya, practicing in Kenya for more than 13 years. I would like to add something. It's regarding immigration status. Why are they using two measures for one nation, for one country? Imagine when we come here, the visa is free. Means we are considered members of East Africa community. Sometimes when we go with Kenyans in our country, I took more than 2 people, Kenyans in my country. They didn't pay for the visa. Means Kenya is member of East African community. Why, when it comes for license, medical license, they consider us like outsiders or foreigners. When we go to tourism places here in Kenya, we are considered like member East African community. Why now when it comes for renewal of our license, we are now foreigners. Thank you so much.
Thanks.
Maybe
Thanks.
for the sake of the French people, if I want to address them, so that they can
The French. Yeah.
Yes. Allow me to speak in French for the sake of our people in Congo. Oui, à nos autorités au niveau du pays, la RDC, à notre cher président, Félix-Antoine Tshisekedi, et au gouvernement congolais. Nous, médecins congolais, résidents et pratiquants au Kenya, depuis plusieurs années, nous voici aujourd'hui devant vous via ces médias pour vous exprimer notre déshydratat en ce qui concerne la situation qui nous frappe. Nous sommes ici en train de plaider une cause noble, laquelle cause fait ressortir la discrimination criante que le peuple congolais est en train de subir sur un sol étranger. Cette situation fait preuve d'une précarité qui frappe nos familles, en ce sens que nous sommes refusés de renouveler nos licences de l'année 2026 et que nous ne serons pas à mesure de pratiquer à quelques endroits qu'il faut. Mais ici, en tant que membres des États d'Afrique de l'Est, nous en appelons à nos autorités de faire d'urgence parce que, jusqu'à preuve du contraire, il n'y a aucune autorité, on va le dire bien, aucune autorité du pays, même au niveau de l'ambassade sur place, qui nous a approchés pour nous dire quelque chose en ce qui concerne la situation. Bien que le message a été passé clairement sur différents médias, même au niveau du pays. Voilà pourquoi aujourd'hui, nous nous tenons devant vous pour vous dire, le peuple kenyan nous a acceptés et nous avons rendu bon service. Jusqu'à preuve du contraire, aucun médecin congolais n'a été poursuivi pour quelque chose de mal qu'il a eu à commettre sur ces sols kenyans. Alors, il faudra qu'au moins qu'il y ait des mesures drastiques qui peuvent nous permettre d'évoluer, à travailler dans la quiétude, parce que même au niveau du pays, nous avons les institutions kenyanes qui sont en train de travailler là-bas. Mais pourquoi la réciprocité dans la diplomatie n'a pas été toujours d'avis? S'il y a un silence, à quoi s'attendre? Ces familles qui sont en train de couper. Nos enfants, actuellement, ne sont même pas à même d'aller à l'école parce que nous sommes frustrés. On ne peut pas bouger. D'une minute à l'autre, on ne sait pas ce qui peut nous arriver. Alors si ce silence va continuer, ça sera vraiment dommage. Alors pourquoi nous appelons aux autorités de voir, de communiquer avec les autorités kenyanes pour nous permettre de voir au clair la situation de la RDC. Nous sommes ici, État membre d'Afrique de l'Est. Faites un effort pour nous adresser à cette situation. Merci.
Thank you. Thank you.